Hi, Dr. Paul here. C'est Dr. Paul.
Hi, Doctor.
Hello.
Hello, Doctor.
Bonjour.
Hi, Dr. Paul.
Bonjour.
Hello.
Bonjour.
Bonjour.
Dr. Paul. Dr. Paul, just
Yes.
a request before you start. When we get to the question and answer session, if you have a question or answering a question from our French colleagues, would you mind briefly just translating that into English so we're privy to the information?
Okay, good one, Bill. No problem, Bill.
Thank you.
Thanks, Bill.
No problem. Get in. I'm ready to go.
Perfect. So good afternoon, everyone, and welcome to the Daily Media Briefing. So Dr. Paul will provide this update on COVID-19. Like usual, he will put it in English first and then in French, and he will then take questions from the media. So we would appreciate, as every day, that if you can mute your phone until the question period. Donc, bonsoir à tous et bienvenue à notre point de presse quotidien. Donc, Dr. Paul va donner les dernières données mises à jour sur le COVID-19. Il présentera d'abord en anglais puis en français et répondra ensuite aux questions des médias. Nous vous demandons de bien vouloir mettre vos téléphones en sourdine jusqu'à la période de questions. So we'd like to invite Dr. Paul to speak.
Great. Thank you very much. Merci tout le monde. Welcome. I'm just going to give you a bit of an update of since our last media update on Friday. Over the weekend, we had a third case, and if you look at our website, we actually had a fourth case as well. We are now reporting cases on our website. No more press releases because it's just that they'll be adding up, I'm sure, and so we'll be just posting them on our website. I'll talk a bit about those two cases. I want to give you a bit of an overview of what else happened over the weekend, and I can more specifically go on those. Over the weekend, we also, due to the number of questions that we had and sort of confusion by the public, we essentially we're having questions about gyms. Were they under the order? Were private daycares under the order? And because of our numbers, because of some of the cases that we're seeing, one of which we had no real contact in terms of travel, and because we have a vulnerable population, I extended and or clarified with a Section 22 order yesterday that was issued that would clarify that all daycares are to be closed, including private ones. I know that the ministry announced yesterday that there will be some exceptions for parents who work in the essential services, and we're working with our municipalities for that one. The other ones that we've done is we stipulated that gyms are recreational sports centers and they should be closed as well. In addition, I extended the closure to all personal service settings, which essentially are barbershops, tattoo parlors, and so on. And finally, I extended the closure to all churches and places of worship. And so, juste pour dire un petit peu en français, on a eu pendant la fin de semaine 2 autres cas, donc on est rendu à 4 cas. Dorénavant, nous allons poster les cas sur nos sites web et des autres choses qui sont. Et puis je vais répondre aux questions spécifiques après. Mais juste pour vous dire que pendant la fin de semaine, j'ai donné une ordonnance à travers de notre région pour clarifier des choses et bien ajouter un peu des fermetures. Premièrement, c'était plutôt pour clarifier des questions qu'on avait. Donc, je clarifiais que c'est tous les garderies qui étaient affectées, sauf à un moment donné, hier dans l'après-midi, on a il va y avoir des exemptions pour les garderies qui prennent soin des enfants uniquement pour les professionnels qui travaillent dans les milieux hospitaliers et des autres métiers essentiels. J'ai clarifié que le gymnase font partie des centres récréatifs et sportifs. Donc à ce moment-là, ils devraient être fermés. Et aussi, j'ai clarifié que tous l'église et les espaces de culte devraient être fermés. Et j'ai ajouté aussi les places où les tatous, les coiffeurs, etc., les places pour les services de soins personnels. Donc j'ai ajouté ça. So going back to some of the other things that are going on, obviously we're keeping a close eye on on the situation. We're looking at our numbers. And the other thing that happened as well is we opened up an assessment center in Hawkesbury this morning, which is in partnership with the Hawkesbury Hospital. And in that situation, it opened this morning. I was there. I did some media availabilities. It is meant to essentially, right now, people want to get tested. They will go there and get tested based on certain criteria. And I know I had some questions here. The criteria still, you have symptoms of COVID, which are respiratory symptoms, cough, runny nose, fever, those type of symptoms, plus a history of travel or a history of contact with somebody who's had COVID. So that's our first one that's opened, and we're planning to open several more this week, one in Cornwall, one in Winchester, and we've also got Alexandria and Castleman as backups as well. The trigger for opening these really is increased demand in the emergency rooms, and so we'll be notifying media as soon as we open them. We'll be working with the hospitals themselves to determine whether or not they can take the capacity in the emergency room, and again, this is meant to divert it. L'autre chose que nous allons faire cette fin de semaine, c'est que ce matin, c'était l'ouverture du centre d'évaluation et de dépistage à Hawkesbury, et ça a bien été ce matin. On a commencé à 9h et on fait les dépistages et aussi des tests au niveau des personnes qui se présentent. Il faut dire que on a les critères pour lesquels on va tester les gens. Disons qu'on a besoin actuellement d'avoir une histoire de retour au Canada dans les derniers 14 jours et aussi avec les symptômes, ou une personne qui a des symptômes de COVID, soit nez qui coule, la tousse, on a la fièvre, on a la misère à respirer, etc., avec une histoire de contact avec quelqu'un qui est confirmé avec le COVID. Et puis l'autre question qu'on a, c'est que si avez-vous ouvrir des autres? Oui, on a des plans d'ouvrir Cornwall, Winchester, Alexandria et à Castleman. Et ces 4 autres vont mettre en vigueur selon le besoin de l'hôpital et l'activité de COVID. On a des plans pour Cornwall et Winchester, probablement cette semaine, plus tard dans la semaine. Et Alexandria et Castleman aussi, on va s'entendre avec les hôpitaux pour voir le niveau de congestion qu'ils ont à l'urgence. Donc, ça, c'est une autre chose que nous allons faire. Ça fait partie de nos plans de vraiment essayer de débloquer les urgences pour laisser les gens à l'urgence de travailler avec les personnes qui ont besoin. Donc, toujours on a toujours un but de diminuer le taux d'infection dans notre communauté. The other, like I said, so as we move forward, we're going to be again going into modes. We're going into trying to see, as you know, just this afternoon, the Premier announced that there would be a closure of all non-essential retail stores and non-essential workplaces. We're waiting to see what the definition will be. Apparently, we're going to be getting that tomorrow. This does not surprise me. This is, I think, part of our expansion of our public health measures. Cet après-midi, le Premier ministre d'Ontario a déclaré que demain, tous les places de commerce ou des places qu'on travaille vont être fermées. On va avoir les définitions plus étroites demain. Mais ça me surprend pas parce que on commence à faire une expansion de nos activités de santé publique au niveau de distance, etc. Donc, je pense que le message que j'ai à tout le monde, c'est que pour le dépistage, c'est une autre chose. Je vais juste retourner, je vais le dire en anglais aussi. Au niveau des centres d'évaluation, pour le moment, on fait un dépistage au niveau des tests, les tests pour les personnes qui ont les critères. Mais à un moment donné, une fois que nous avons un établissement de COVID dans notre communauté, on va arrêter à faire les tests. On va offrir les services d'évaluation médicale pour des personnes qui ont des symptômes, mais qui sont pas assez malades d'aller à la salle d'urgence. Donc ça va être l'évolution des centres de dépistage. So I wanted to say that the current role of the assessment centers / testing centers really are to screen people to see if they have the criteria for being tested. There really isn't a medical evaluation per se. However, as we see extension of community-based transmission in the community, and we get a lot of people sick. Hopefully that number is minimal, obviously, but as we see that increasing, there's going to be a time where we're not going to be testing anymore. We're going to presuming that everybody who's got symptoms has COVID, and so most people, and 85% of individuals, will not require hospitalization, but among them they'll be worried, they want to get tested, or they want to get examined medically, and that's why these assessment centers will serve that purpose, where these individuals can go instead of going to the emergency room. So I just wanted to clarify that in that sense. So I'll talk about some of the cases. We had a third case over the weekend with no history of travel, and we've taken care of the home contact. We had another individual, a 60-year-old woman who was we think is a contact, was in Vancouver for some meetings, and so both of these individuals are doing well and at home under isolation, and we've followed all, and we're in the process of doing some of the tracing of the contacts. Now I have some other questions here that I'd like to answer proactively, and then that have been sent by you. One of them was provide information about the assessment centers, and I did. Talking about how many do we have, je l'ai fait. And I have another one, qui est accès, about, il y avait une question pour qui va accès au test, je l'ai expliqué tantôt, I explained that. The other one is, just clarifying, ça clarifie que les personnes avec les symptômes qui ont voyagé, on va les tester, oui. Essentially confirming that we will be testing individuals who have traveled and have symptoms. The other one is okay. I have another one. This is a good one, an important one actually that I think Radio Canada sent. Quelle est la position officielle du Bureau de santé de l'Ontario à propos des grands rassemblements? Essentially asking what do we feel about the number of people should be getting together. I believe the less the better. I know that we have a number of 50, but I think we're going to be going down to 10 quite soon because 50, and the thing is right now with 50, I'm leery about it. Avec 50, j'ai encore des craintes parce que si on met 50 individuels, disons des aînés dans une salle, ça ne fait pas du bon sens. Même si on a 30, ça fait pas du bon sens. So the number to me is a variable one, and we're working with people who want to do those. Where we can say, okay, how many people are going to be there? Can you properly space them out? And in many situations they can't. So even if they're less than 50, if they can't assume those precautions, then we recommend that they don't do them. But I'm leery about the fact that the 50 number will change at some point. Je pense que les chiffres de rassemblement va diminuer de 50 à 10 à peu près, comme on a vu dans les autres régions, à New York et à Québec, je pense aussi. So that's the other one. And then I've got another last one here, talking about details of the case, and I've given that. So the last one is, what is my recommendations for the public? C'est quoi la dernière recommandation publique? The first thing I want to say is that we're experiencing, and that's one thing we're bracing for right now, is that yes, people will stay at home, and that way will not expose themselves to the virus and not give it to others. But one other thing that worries me about is we're having hundreds of thousands of people return, particularly from the United States, starting, yesterday and over the next week or so. And they're coming back from places where they've had contact with that, and surely they're going to bring back the infection. So it's very important for us to stress and really, really stress, and we're sending out a press release as we speak, that I can't urge enough individuals who are coming back from out of the country that they must self-isolate for 14 days. That means that they either drive through the border or go to the airport, arrive in Canada, go home. Don't go to the grocery store. Don't go to the pharmacy. Don't go to the mall. Just go straight home and stay there for 14 days. That is the biggest thing you can do to help us prevent the virus. Now, if you develop the infection, we can test you and we can take the necessary precautions and isolate you, but at least these individuals have not spread it into the community. So the important message is you must stay home if you've traveled outside of the country, and obviously the stay-home message is for as much as possible for everybody. Work at home, stay at home. Stay home, stay safe. Je vais le dire en français aussi. Mon dernière recommandation, vraiment, c'est que on s'attend d'avoir 300-400 000 personnes canadiens qui vont retourner des États-Unis en surtout. Et moi, nous avons peur, en effet, que ces personnes vont amener le virus chez nous. Sûr et certain qu'on va avoir des cas, mais l'idéal, c'est que ces personnes-là doivent être isolées tout de suite, soit qu'ils retournent des États, par exemple, soit qu'ils vont être en auto, soit qu'ils passent la frontière, ils vont aller directement chez eux, ou soit qu'ils arrivent à l'aéroport, ils vont aller directement chez eux. Faut pas arrêter aux épiceries, aux pharmacies, au centre d'achat. Faut aller à la maison et rester à la maison pour 14 jours. Comme ça, si on tombe malade, si ces voyageurs tombent malades, à ce moment-là, on isole, puis on pourrait vraiment confiner, restricter le virus chez eux. Et comme ça, on va diminuer le taux de virus qui va circuler dans notre communauté. Et surtout, c'est parce que on voudrait vraiment protéger les gens qui sont plus vulnérables, soit les aînés ou les personnes avec les maladies chroniques. So I'm going to leave it up to some questions for the next 5 minutes.
Okay.
Go ahead.
James Morgan here at the Review in Van Cleek Hill. Two quick questions. Is it still advisable that people do not wear masks in public in order to protect themselves?
Yes, it is. It is. First of all, we're still having a shortage, although we've ordered a lot of masks, but they haven't come in the bulk order from the province. But I can tell you that the masks do not protect people from getting infected. They only will protect others if the individual wearing the mask is sick. Now, and the thing is, like, our healthcare workers who wear the mask, like this morning we were at the Hawkesbury Center there where the nurses were all wearing PPE, protective equipment, personal protective equipment, but it was a whole sort of kit. They were wearing gloves, they were wearing gowns, they were wearing sort of caps, and they were wearing a mask and a face shield. So that is complete protection. And there's a protocol of removing the mask. So there's a way of doing it, washing your hands afterwards. What happens is if individuals are wearing a mask, first of all, the mask only is a couple of hours. And so when you take the mask, a lot of people take it down, they take a breather, they take a drink, they put it back up. That defeats the purpose. And what happens is when let's say you have gone somewhere where the virus sticks on the mask, people take their mask off with their hands, then they touch their face, and they've infected themselves. So no, we do not need masks.
Okay. One more quick question.
Dr. Paul?
Oh, sorry, I got one more from James, and I got the next one. James, go ahead.
We're getting the geographic location of the different cases, and it's rather open-ended. It just says Prescott, Russell, or the county region. Will we be able to get even a local municipality indication?
No, at this point, because we want to protect people's privacies, we're restricting it to just the counties.
Okay.
Like it's small towns here, right? So we want to protect people's privacy.
Okay. Next question. Dr. Paul, Phil Blanchard, Morrisburg Leader. Yes. What's the wholesome picture here we're looking at? Because when we look at your public health colleague from Ottawa Public Health, she says that there's a lot more infection out there, 4,000 cases, but they're not formally diagnosed. What do you think that the actual real number could be here right now? Well, just to add to that, and how prepared do you think our hospitals really are? Because I have one source that says we have 50 ventilators at the Winchester Hospital. There's 100 beds at Dundas Manor. So there's not a lot of chances. Are we looking at having our hospitals overrun if this thing reaches a full outbreak?
Well, okay, I'll answer the first question, which was, just remind me again, I just have to focus
about what the real infection rate in this area.
Well, so look, my colleague, Dr. Vera Etches, is a good friend of mine. I speak to her all the time, and her rationale is as follows. They're not 4,000 confirmed cases, okay? What they're saying is, okay, for every case that we have, maybe we miss 20. Based on that, 20 people can infect 40, and so on and so on. That's how they do the math. Those are modeling exercises. So if you do the same with us, we'd say probably, we have 4 cases, and you'd say, okay, maybe for one you missed 20, so you got 80. You do that math that way, right? So I'm not really hung up on that. I'll tell you why, because I'm assuming that the virus is here. So I want to behave as if the virus is here, so we can then be able to collectively diminish its opportunity to grow and spread in that way. So it's a mathematical modeling that she's doing, extrapolating it. So, if you're looking at our numbers, we have 4 right now. So you can kind of do the math to say 80 and then 160 and then 320, like that type of thing,
right,
based on that. So I look at the modeling just because I just want to get an idea of what's going on. But I'm trying, the goal is to try to offset those. And so I tell people, let's pretend it's here. Let's pretend we have many cases. This is how we have to behave right now.
Right.
The second comment that I make is, yes, we have ventilators. We have a pool of ventilators. As a matter of fact, there's a pool that's going around in Champlain. So even though the Winchester Hospital has 50, they have access to more. And I know there's a central depot of several hundred as well. So yes, it's always we're always worried about our capacity, but that's why it's so important that we pretend that it's here now and fight it now with these extreme measures. That's why it's important.
Thank you.
Thank you. One more question.
We have 3 confirmed cases, right?
We have 4 actually.
4.
Yeah.
We have the details on the 4th one by email?
The details they're on our website right now. It is a 60-year-old female who we think got contact. She was traveling outside of this area in Canada, though. Developed symptoms and was tested in Ottawa. And she's doing well at home on self-isolation, and we're in the process of tracing her contacts. All of them were from Prescott Russell area, and so that's the 4th one that we had. The 3rd one was a gentleman, 30 years old, and those are all on our website right now.
Thank you.
And based on those last 2 cases, are you prepared now to say that we do have community spread in the 5 counties?
Yes, I am. I am, because the one case, the three we can trace it, but the one we have not found a source. So I'm saying we do have community spread, and I'm assuming that we do, and that's why I'm being aggressive with my measures.
So, Dr. Paul, then does that mean testing stops because we have community?
No, not right away. No, we're going to have to. The other thing too is the testing will give us an idea of what the magnitude of the infections are. Like now we're guessing because it was 1, right? So it'll just give us an idea of that, and we're actually looking at. We're speaking with the ministry to see what's the threshold of testing is when we stop. Like 1 case is not enough as far as I'm concerned, but I think that we will be testing, and then at some point there'll be that threshold. That I have not identified yet, and that's going to be done in conjunction with the Ministry and Public Health Ontario, which is our agency for health protection and promotion.
Dr. Paul,
I'll take one more.
From a mortician, not a mortician, but somebody asking about morticians. Do they have to take special precautions, in the case that they get bodies from people who have died from this?
Actually, they've called me on that, and I spoke to them about it. I've sent them. There are a whole slew of precautions they need to take, but they're no different than what you would take with somebody who's had influenza.